As I have already said at the beginning, we are presenting the project SOS, Sustainability of Services for Key Populations in the EECA region. Even in Russian, we found the equivalent, which is not SOS, we call it US, Sustainability of Services, that is устойчивость услуг. So we have the different options to think about to plan. The consortium is truly big, unusually big for such regional projects. Because you can check the logos over here, there are 4 of them. And there is a reason to that. Because we have formed the backbone of our consortium. And really, after that meeting 18 months ago, we have made a long journey, and together with Network 100% of Life and the Central Asian Association of People Living with HIV and European Key Population Network, EKHN, but that was the impetus, a catalyzer to engage all the partners that you see on the screen. But here you see the recipients of the funds, but there are also key technical partners such as UNAIDS, and UNPP. But there are partners that will join the project at the country level, including the Balkan countries. So not all of them are presented on the screen, but it's also a significant thing that having received the fund and we don't keep it in our narrow circle. We try to involve as much as possible those who will be practical implementers of the program in the countries and cross-country networks. If we speak about the project, what's so special about it? First of all, it's the scale of the regional partnership, because none of the projects I can remember covered such great scopes. First of all, to be frank, a lot of donors and principal recipients avoided working in Russia because it is difficult. But for us it was a principal decision, value-based decision, because we cannot achieve serious radical changes in the region without doing anything in Russia. Therefore, actually in Russia we have one of the most complex components involving and including the work to reduce the prices, conducting different fora and working on the city level. Another innovation is a serious involvement of Southeastern Europe countries. There have been cases when 1 or 2 countries were involved, but as far as I remember, it was only 1. Now we're speaking about full-fledged participation of the Balkan country, 5 countries, the regional CCM, including all the countries at all of the Southeastern Europe. And that's a great plus, great benefit for the project, because that's something we had to fight for, because originally we didn't have it in the regional application. We heard the Balkan countries were submitting their own application, but haven't heard that TRP have supported our consortium. We initiated joining our efforts for the project of key populations and the Balkan project, so that the funds allocated to thus could be used as much as possible with the highest effectiveness for the countries, for all those who require the funds. And talking about the Balkan countries, some good success stories have been mentioned, but I recall the meeting of the board in Skopje last year, because the experience of Macedonia now, Northern Macedonia, drew the attention of everyone as the best practice among all the countries of this sub-region. There have been also other successful cases. So for us, the EECA region is a region of the former Soviet Union, or maybe something broader than that. But this project opens new opportunities for cooperation, full scope cooperation of all our region, all the countries in our region that you see on the map. We are speaking about 14 countries with specific focus on the cities, 23 of them. And one of the concepts was that we cannot, under a regional project, to work everywhere simultaneously. Therefore, the focus on the cities was conditioned by selecting the cities with the highest numbers of HIV positive people living there. So this was some reasonable selection. When working in the cities, we can influence the national level as well. Now, talking about the participation of the Russian Federation, well, I've already spoken about that, but I'd like to particularly thank our colleagues who who were able to come. I actually hope that everyone who was willing to will be here. And it's an honor for us. For this purpose, for this project, we all united our efforts. That's important because there are too many factors that disunite and provide the sources of conflict in the region. And it's important that we have been able to get together to work. And we hope that even this transition to Russian and English is a good learning and a good motive to understand each other. Talking about the goals of the project, there are 3 of them. All of them are ambitious. And the main 3 goals are to improve the sustainability and effectiveness of financial sustainability and effectiveness of HIV programs, to remove the most significant barriers to access to services on prevention and care services for people living with HIV, and finally to improve efficiency and affordability of HIV service delivery models for key populations. It's not a secret that the best package of services or innovations are not available everywhere. That's why
we plan to find some points where we can cooperate and exchange the knowledge, where some innovations could be started in certain countries, taking into account the experience of their implementation in other countries. As for the format of cooperation, we also understand that the regional project does not exist somewhere in the air. The Global Fund is still working in the region, and in some countries there are national grants of the Global Fund still available. So our idea is to make sure that in countries where there are national grants, to achieve the task set, we plan to cooperate with CCMs and with the principal recipients and resources available within the national grants. And due to such cooperation, we the planned results and deliverables. As for the budget of the project, The main area and the main focus is advocacy for ARV's price reduction and optimization of procurement mechanisms. So you can see in the structure of the budget, it's 43% for this component. So that's a big part which again will be implemented through multiple areas of work, working in the countries and working at the inter-country level. The second component is budget advocacy. So we plan 25% of the budget for budget advocacy, or $3.2 million. Removal of legal barriers is the third component, which takes $1.6 million. You can see it in gray. And also we have operational research. So those are the research studies which will form the evidence to start new initiatives. So the idea is not just to start some initiatives like let's introduce PrEP or let's introduce optimized case funding or OCF through the networks of contact persons of key populations, but at the same time to do operational research studies which will help to prove the efficiency of such interventions, that really those interventions, they help, like for example PrEP helps to reduce transmission of HIV, or the OCF, optimized case funding intervention, helps to increase the yield of HIV cases detected as compared with the standard approaches by 8 to 10 times. So it worked in our country, in Ukraine, it worked in other countries, but we would not like for other countries just to believe that those interventions work. And also for advocacy, when talking to the representatives of the ministries of health and the government, it is important to have evidence base which can be obtained through operational research. And if we talk about some more practical things, according to the budget, the biggest objective is ART optimization and price reduction. So on the screen now you see a very big number, so over $73 million are planned to be saved through the optimized ARV procurement schemes. So both in terms of procurement and regimens optimization. So here we see what we're going to do. So developing strategies to optimize the cost of ART regimens and advocacy activities aimed at reducing ARV prices, which will allow to redistribute resources for prevention and care services for KPs. Also, one of the areas is optimization of clinical guidelines on ART and the list of medicines in accordance with the WHO guiding principles, and advocacy to include countries in the voluntary licensing and registration of generic drugs manufacturers. We know all these things actually, and until lately many people were saying like, yeah, we are working in this direction, this is something that we do. But what is the new approach that we used? We actually put the number down, the number which is very ambitious, and this is really very big savings at the regional level. And you see that we didn't just round this number, we calculated it's like almost up to $1. It was calculated because we didn't just take it from the air. This number is confirmed at the level of each country, so it can be divided into each country which did its own calculations, and these calculations are the basis of specific commitments. So in all the countries, the proposals were approved by CCMs, so country coordination mechanisms, and those numbers they were seen by the ministries of health. In some countries, our main counterpartners are governmental agencies. So we are not only talking about a consortium of civil society. First of all, we were thinking who can make sure that those changes happen, who is interested to promote them, and who can actually promote them. So in some countries, the leaders will be the civil society. In other countries, the government. And representatives of the government are also present here at the meeting. So today it is the most ambitious target, and I have never heard about such target in terms of optimized procurement. And this optimized resources will allow to scale up treatment programs, what Dmitry Sherebey said, and also we will be talking about optimizing procurement mechanisms to redistribute part of the savings for services for key populations. Also, we can take an example of Ukraine. See how the Ministry of Health procured methadone, because there was no budget line procurement of methadone. But thanks to savings from procurement of ARVs, we were able to make sure that there were some savings to be used due to all the efforts and advocacy to be used to procure methadone. And we know that there are some examples when optimization of procurement also allowed to have extra money to procure services from NGOs to provide projects and services for key populations. So those are not just some theoretical virtual things, those are things which worked in some countries. The next component is budget advocacy. So within this area of activities, we plan to develop or update the functional mechanisms for public procurement of prevention and care services. So again, in some countries we can talk about social contracting mechanism, in some direct procurement of services, or some other mechanisms can be used. Also, we are talking about actually investment into NGOs to build their capacity on budget advocacy issues and on the redistribution of funds and relationships with government institutions. Most NGOs, this work for them is something new. They do not have enough resources or enough experience to do that. So that's one of the key areas of our activities. Also, here we have support to the development of the national guiding principles for social contracting and advocacy for the approval of municipal programs and funding for relevant activities. So in some countries we see the decentralization processes when there are more and more resources given to the level of municipalities or cities or provinces and oblasts. So, not all the resources are now concentrated at the central level, especially when we are talking about services for key population. So that also should be a focus of our activities. In particular, to advocate for municipal funding. So again, we made calculations for this budget advocacy component, and we got more than $10 million. Actually, it's $10,250,000, which should be an absolute increase of the domestic funding. The next component is improvement of 1990 cascade. So that's what Vinay was talking about. So really, the period of project implementation correspond to the period of achieving 1990 targets and reduction of the new HIV cases by 75%. And we think that this project, in cooperation with the national grants, will lead to a significant improvement of the cascade. So today, in the cities and provinces, we have a little bit over than 280,000 people living with HIV registered in the cities of the region. So in coordination with the national grants, we are planning to increase this number by 75,000 people. So also this big task can be divided into smaller tasks for each city and country. And this indicator is actually linked to the second 90 target, so of provision of antiretroviral therapy. And we are talking here about 90% of people diagnosed with HIV receiving ART, which will cover 252,000 of people living with HIV receiving ART. If I talk about more specific interventions, one of the key interventions will be removal of legal barriers. It's not a secret that in the providing services to key populations, of course, funding is very important, but often it's not a decisive factor, it's not the only one. What is very important here is to reduce or even remove barriers in access to such services. And access not only to treatment but also prevention services. Here we can be talking about legal barriers sometimes, but in some cases we're talking also about violation of the human rights. So basic rights to access services can be sometimes violated. So with the help of the mechanism, which is called REACT, so that's an abbreviation from Rights Evidence Action. So like actions based on the rights. So we plan to implement at the country level a system for monitoring and response to human rights violations, which will be managed by grassroots NGOs. So the task of the system is to respond to crisis situations, to decide on a proper combination of human rights-related interventions within HIV response activities.
So we need to identify the gaps that exist in this area of human rights, and we need to collect the evidence of violations of such rights related to the access of key populations to the service. Our partner in this component is the organization called Frontline AIDS. A lot of you know it as International HIV Alliance from the UK that had a rebranding in February. Now it's Frontline AIDS, and you see their logo on the brand wall. I would like to separately note the unique role played by the regions. Originally, in the project design, we planned to work in this direction, but moreover, I'm really happy that by engaging more resources, we were able to broaden as much as possible this area of activity of the project. So we have a number of partners whose logos you see on the screen. And in terms of applying the efforts, the EKHN is focused on supporting the development of operational research on transgenders, building the capacity of transgender organizations, supporting the overarching. There are 3 cooperating networks. NPOD, EHRA, and ECOM will be focused on collection of data on human rights violations at the community level as a barrier to access to HIV services and advocacy activities after detection of the violations. Here we also have this link with the REACT program. Additionally, EHRA, the European Harm Reduction Association, will perform the analysis of transition plans in the project countries and development of the report on the best practice of social contracting. This is a very important part for us in the region, this transition to sustainable funding. And that sustainability is reflected in the name of our project as well. So this direction is quite important, and we have to implement it in close cooperation with the countries, because it is on the level of the countries that the transitional readiness assessments are formed as evaluating the country's readiness to perform this transition, and the plans for transition are designed. So this is the general task for the project as a whole, and when I'm talking about the sub-tasks, sub-objectives, it doesn't mean that we simply delegate it and then it's your problem. No, this is one of the key things. We will all play our part in this. Another important issue is integration of TB issues in the transition plans. I recall that first meeting when we discussed the terms of reference, and it was really difficult to promote the tuberculosis issues, to include them in the terms of reference, and it was really difficult, yes, because they said we will have 2 grants, one for HIV, another for tuberculosis, and there was some internal protest against that situation, especially after we saw the terms of reference of the TB contest. The competition was purely technical, without much concentration on sustainability, on budget transition, budget advocacy, and that's why we took this risk intentionally, because even though we were dissuaded, we united our efforts with TB People Network. And second, if we are doing the budget advocacy, price reduction, reaching the ministries of health, the parliaments of the countries, the decision makers, and we speak only about HIV and keep silent about tuberculosis. Well, we decided that was wrong, and that was our position. We insisted that this component was included, and it is included. Another direction is the mobilization of the communities. A forum of the people who use drugs, and the conference of MSM and transgenders, as well as other activities to mobilize the communities. That's another important component. We have another important line of work, that's the work to involve consultants, SWAN consultants for technical expertise. That's the sort of work that we perform with sex workers, and it's just as important for us as the work with other key populations. So initially we considered this a sub-granting format, but then, well, our position was we go for the acceptable format for cooperation. We are not into formalities. And if, as a result of the discussion, we will reconfirm that for SWAN, the most optimal format of work will be the work with representatives in the key countries as consultants, or using another format, okay, let's take this way. If it's about sub-granting, okay. For us, it is important not to miss this issue, not to miss this key population, and that's one of our key. I've already spoken about operational research to enable us to reach better results of the cascade. So we got several examples of the research plan, that's the OCF and CITI, optimized case finding, optimized way of identification of infection cases, and CITI, community intervention treatment initiation. So that's the initiation of treatment at the level of community. So if we make the first contact, we don't lose him or her, and totally support them, linking them to care at a healthcare facility. In the Russian Federation and Uzbekistan, we are planning to do that activity. Self-testing is planned to be developed in Georgia and North Macedonia. Transgender interventions are planned for Georgia and Kyrgyzstan. PrEP, it's Belarus, Bosnia and Herzegovina, Moldova, North Macedonia, Montenegro. Those are the interventions that may be started together with the operational research, and we expect that they will be or may be supported with local national funding and probably some research. This project, as we've said, is related to human rights and violations of the human rights, but in many aspects it's related to the existing punitive drug policies in the EECA region. There are ways to change it. One of them is the Global Fund mechanism that has worked in other countries of the world. That's involvement of the Global Commission on Drug Policy. For us, the EECA region, there is so far no evidence to prove that the changes in repressive drug policies, humanization of such policies, would enable saving money, saving lives. So preparing such evidence, a high-level document, a policy brief to be accepted by the Ministry of Health and governments in general. Well, we plan to do that either involving the expertise of the economist They have the Economist Intelligence Unit, and if you maybe heard about tuberculosis, they calculated that the investing in fighting tuberculosis is the most effective compared to other communicable diseases. It gives the biggest benefit, and everyone knows that in the Global Fund, among donors, it's used in the replenishment. So we want to have similar effects with regard to the drug policies. Now, talking about the format, there are several options, either a nomination of candidates from our sub-region to the Global Commission on Drug Policy. Now the members are Mr. Kwasniewski, Pavel Bem, mayor of Prague, former mayor of Prague, and Kwasniewski now is a former president of Poland. So they represent our sub-region. So it requires candidates to be recognizable and known in our region. People who would be able to not simply say that simply and convincingly both in English and Russian. Or we may establish a special commission on drug policy in the EECA region. I would like also to say a few words about the words that we have already made some first steps, and we're not just speaking about that. We have specific results. Yes, the project has been going on for less than 3 months. It didn't start exactly on the 1st of March, on the 1st of January, sorry. And we had the New Year holidays after that, and we were signing the agreements, and they were finalized only in mid-January, and the funds were received later even, but it is less than 3 months. Basically, that's about 80 days, 2.5 months. What have we done during that time? During that time, we have catalyze the transition from donor to governmental funding. For example, if we speak about Ukraine, we are focused on planning for a phased transition to public funding of prevention care and support services for the key populations. It's not like we are only following the plans adopted a year ago, 2 years ago. We need to take into account the risk factors, even if they appeared as late as last week. So that's a formation of some sort of a flexible system allowing to have this phased transition going on successfully. And in Belarus, there are active negotiations to remove the patent protection on DTG. In Moldova, a decision has been made by Chisinau municipality to support the municipal HIV response program. In the region of southeastern Europe, there has been a call for proposals. That was a sort of mobilization of work of all the NGOs, as well as activation of the operation of local CCM.
Besides, sub-grant agreements have been developed and signed with the network 100% live with implementing partners in 8 countries of the region, and we hope that this week, even today, other agreements will also be signed, taking into account that all our partners are here, and over 620,000 disbursed for the project implementation for the first half of 2019, and a competitive selection of applications was conducted in southeastern Europe region. Actually, a decision was made to disburse funding in the amount of over $1 million, and the project oversight advisory committee was formed. And we are really thankful to you that you are ready to get involved. it is really important for the project to have access to your expertise. So we have Mick Matthews here, represented input in the committee, Ruth Morgan Thomas from NSWP, Nadia Rafi from Impact, Friedrich Konrad from Elton John AIDS Foundation, Ryan Keating from PEPFAR CDC, Katerina Lukicheva from OSF, Rico Gustav GNP+, John Macaulay UNDP ICA, and Vinay Saldana or Roman Khailevich from UNAIDS regional office in ICA. We are thankful to you for being ready to help, because as we told in the beginning that our region is very problematic, the epidemics are growing, so the expertise which can be brought by the networks, global networks, they are very important. So someone will contribute their expertise more. Someone also will help to coordinate the project, because they support or help us to implement the project in the region. And some will provide general guidance, such as UNAIDS. So for us, it is important that this committee will have an informal meeting. Well, not informal, but rather like kick-off meeting will take place within this conference that we have today. And what else? We had a visit of Belarus representatives to Ukraine to study the PrEP program implementation. So they were both civil society and government representatives, and we worked both in Alliance and in the AIDS Center, and we also went to NGOs, and we really our colleagues could see how the pre-exposure prophylaxis models are implemented, and it is a necessary stage which will help to introduce also PrEP program in Belarus. Also, we had meetings with the municipalities of Chisinau and Dushanbe to sign the Paris Declaration and to adopt the municipal HIV response programs. Also, there were visits organized to 5 countries, Georgia, Kazakhstan, Kyrgyzstan, Belarus, and Moldova, to conduct baseline assessments. This is also a thing which is really done within the project in the first 2 months, because usually there were just some calls for proposals, but we already have started active activities. Even though not all organizations have already received funding, it is difficult to start this project everywhere at the same time, and we are thankful for your understanding and patience. And I have not named one format of cooperation which I would like to name. We agreed with the PAS Center Moldova, and PAS Center also coordinates 2 regional projects. This one for HIV and another regional project on tuberculosis. This will be another form of partnership, taking into account that in our project we also have a sub-component on tuberculosis. So that's the final slide. It is about partnership, because we were talking about ambitious results, but they cannot be achieved if we act alone. So for us it is very important, because we have worked on this project maybe a little bit longer than you did. So for a year and a half we were thinking about it really hard, and we want to share this feeling of involvement and commitment with you. We want you to feel that that's your project. We want all of you to feel that this is an opportunity for you. As Dima said, that we will not have dozens of such projects. Maybe it's the only one. Maybe it's the only opportunity. We do not really know how the situation will develop. That's really an SOS situation with the very serious preconditions to survive and to progress and to become happy. But there are other scenarios, more negative. So let's mobilize our forces and efforts and achieve everything that was planned. Thank you.